my dear friends. This is your host, JYOTSNA Sharma, welcoming you to Mana TV International and Mana TV. This is your special show, Community Special with JYOTSNA. As promised, I have come back with another special session, another special show where you will gather more information about your mental health this time. During this coronavirus situation, when you are under lockdown and are at home, locked there, not able to do anything, I know it becomes troublesome to manage your mental health. And today we have a special guest who will speak about how you can manage your mental health during the lockdown situation during COVID-19. The guest that I have today is a MD in psychiatry. His name is Dr.BHANU Prakash. He is an addiction psychiatrist and sleep physician who studies the interaction between sleep disturbances and addictive disorders. And he is working on enhancing access to cognitive behavioral therapies for insomnia using novel treatment delivery strategies. Dr. Kola has been a fellow in addiction psychiatry, sleep medicine, and has done residency in psychiatry at Mayo Clinic Graduate School of Medical Education. And he is right now practicing there as well. He is an associate professor in sleep medicine and a couple of other things. Well, Dr. Kola, welcome to Community Special with JYOTSNA.
Thank you, JYOTSNA. Thank you for having me.
Thank you so much for, joining us on the short notice that you have agreed to join the show, and educate my audience. So Dr. Kola, I would need a little introduction from you with the level of expertise that you have in psychiatry. Please briefly introduce about yourself.
Sure. So I went to medical school in India, in Hyderabad. So I graduated from Osmania Medical College. Then I trained in the UK, and I'm also a fellow of the Royal College of Psychiatry from the UK. Then moved to the United States, did my residency, like you said, in psychiatry, then sleep medicine fellowship, followed by an addiction psychiatry fellowship. My clinical practice is sort of split between the two specialties. So I do both sleep and addiction. And I teach medical students, residents, fellows, and also do research in this intersection between sleep problems and addictive disorders.
Very nice, pretty impressive profile. And in fact, people are losing their sleep these days. Yes. And you can be a great help. I tell you, people are losing sleep because they're losing jobs, the fear of the disease itself, and a lot of other things. So to begin with, I would like to know from you, you being a psychiatrist, what kind of cases are you seeing yourself? What kind of cases have increased during this lockdown situation? I'm pretty sure you might be counseling them, or through the teledoc, you might be treating patients right now. And I believe, let us know about your clinic also. When is it opening otherwise?
Now we are open. The Mayo Clinic is open, and we are seeing both virtual visits where we see patients either through video or sometimes phone too, if the patients can't get to computer or other electronic devices. And we are also seeing patients face-to-face, depending on the safety. In terms of what we are seeing mostly now, it's a lot of anxiety, and anxiety sort of spills over into sleep problems. So acute insomnia, which is insomnia less than 3 months, and when all of us have something stressful happen, sleep gets disrupted. That's very common. So we tend to see that fairly often right now.
All right. So now when we speak about insomnia, how should a person distinguish between a normal little bit of sleep disorder, as they might be anxious because of it, and how could they assess that it is really going to be insomnia? It is insomnia, what we are facing right now. What are the features, like what are the symptoms of insomnia?
So we in sleep medicine have a very clear distinction as to what we call an insomnia disorder. So for us, insomnia disorder or chronic insomnia disorder is when people have had sleep problems for at least 3 months, and they need to have difficulties getting to sleep, staying asleep, or waking up earlier than their usual time. And that happens at least 3 times a week, and that goes on for at least 3 months. Plus, that impacts your daytime functioning. So you're sleeping poorly, therefore In the morning time, you're either tired, sleepy, can't concentrate, it's impacting your mood, things like that. So when you have all of that, that's when we make this diagnosis of a chronic insomnia disorder. This is also fairly common. It can happen in up to 10% of the population. But acute insomnia, where sleep gets disrupted, so you have difficulty sleeping, getting to sleep, staying asleep, waking up earlier, but it's not crossing that 3-month threshold. So it's less than 3 months. That's very common. That can happen in up to 30% in normal times. So this is, we're talking pre-pandemic, regular run-of-the-mill day-to-day life. So if things change, we have a stressor, even if good things happen, there are changes in circumstances, our sleep is poor. Most of us who are good sleepers will tend to bounce back, but if it goes on for a little longer, so 2-3 months, then it's likely that it takes on a life of its own and then it becomes chronic insomnia.
All right. Thank you for that input. Dr. Kola, I believe I'm getting some caller right now, so I'll just take a call. Hello?
Sure.
Okay, the call dropped actually.
Oh.
Virtual studios, Well, anyways, I have a list of questions, so.
Sure.
All right. Now, as far as normal sleep routine is concerned, what is the normal sleep, duration a person should have?
So all of us are different. So that, I think, variety is the spice of life. So we all have different sleep requirements. When you look at large population studies, most people seem to need somewhere between, say, 7 to 9 hours. We usually tell our patients, if you have no pressure, so you can get to sleep whenever you want and you wake up without an alarm, so your body does what it needs, that's basically the amount of sleep you need. When you're waking up to an alarm clock or you need to struggle to stay awake, you're shortchanging yourself on the amount of sleep you get. There are rare outliers, so people who get maybe less than 6 hours of sleep or who need more than 10 hours of sleep. So that's a possibility, but those are relatively rare.
So generic is 7 to 9 hours of sleep, basically.
Most people 7 to 9.
Whether it is kids or adults?
So kids need more sleep. And so newborns need much more sleep than most of us. They sleep 16, 18 hours. As kids get older, their sleep requirements go up. But this is again something that most people don't pay attention to, because toddlers, even elementary and middle schoolers, require about 9 to 10 hours of sleep. And when they don't get that much sleep, we tend to see sort of hyperactivity, behavior problems, difficulties concentrating, things like that. As you get to, say, 18 to 21, at that point, you're sort of settling on your normal adult sleep requirement.
Thank you. So now with the COVID situation, when people are mostly at home, people do sleep in afternoons as well. Well, not all though. Okay, I have a question related to anxiety levels increasing during the COVID situation. I will come back to more sleep related questions as well.
Sure.
Throw some light about anxious behavior of people. What are the things that would exaggerate the anxiety in common people during this situation, and how to keep away from them?
Right. So again, it's completely natural when we are in a situation, a circumstance that is out of our control, to feel some degree of anxiety. And anxiety by itself is not a bad thing. It can help us. So we can adjust to the anxiety, use it for our purposes. It starts becoming a problem when it starts interfering with our quality of life, with our ability to sort of plan and do what is required of us. And the pandemic is one of those situations where we really don't have any end in sight. The risks are known to a degree, but it's a virus we can't see. It has a lot of other impacts. So you're socially isolated, so you're by yourself. The sort of social connections that we have, things that sort of keep us grounded, connected with people, you don't have that as much. Plus, it has all these financial implications. So people might be furloughed, might have difficulties with finances. All of those can impact your anxiety levels too. And one of the things to keep in mind is certain things are in our control. We should try and control those. What are out of our control, recognize those and maybe try and let them go.
All right. Now, another thing about anxiety levels and the generic behavior, people are laid back, and I mean, they have been given excessive time to be at home now, right? Some people are working, some people aren't working.
Mhm.
For a normal tenure, they would do all these basic activities, to keep fit, like they'll take a bath on time and, groom themselves and dress up and everything. Now, with the lethargy coming into their lifestyle, and I mean, whole pajamas and whole day, probably they are mostly in PJs, right? How much does it impact the mental status as in mental health,
Mhm.
their level of perception is changing, I mean, they are not in a continuous situation where, okay, they have to attend to a meeting physically, they are moving out, they have something else in the office, coming back, doing groceries outside, errands they are run, usually they used to do. Now life is all of a sudden changed, right?
Yes. So routines are very important for us. So waking up at a particular time, going to bed at a particular time, uh, when we are working, when we have other sort of social compulsions, we are following a particular rhythm. We are eating
Hmm.
at particular times, exercising at particular times. All of those are important.
Right.
The initial few days, I think, with social isolation, it is okay for 1 2 days here or there to let things go. But as this continues, what is important is you continue to maintain some kind of a routine to your day. Our body needs to know when it's time to eat, when it's time to sort of work. If that gets disrupted, there are tendencies to overeat, eat inappropriate foods that can have an impact on your physical and mental health. If you're not having any routines in terms of when to go to bed, when to wake up, that can impact your sleep. So your sleep is poor. In most cases, we say if you want to nap in the afternoon, as long as it's not impacting your nighttime sleep, that's okay. But if you find that you're napping and then your nighttime sleep is disrupted, so you're taking too long to fall asleep, you're waking up earlier, then you're sort of borrowing your nighttime sleep by getting that nap in the afternoon. So our advice would be to cut that out. Again, also staying home, paying attention to things like caffeine intake, so the amount of coffee, tea you drink, soda, getting the right amount of exercise. All of those are important for your physical, mental health, and sleep too.
So what is the recommendation of having this caffeine for, I mean, how much gap should we maintain between our sleep time and the last coffee taken, or any drink, like tea
Any
or anything?
caffeinated beverage, yeah. So again, this question gets asked quite commonly, and my answer is if you're sleeping well, do what you want. You want to have a cup of coffee right before you go to sleep. If it's not impacting your sleep, I really don't care. But if you're not sleeping well, what we want is to try and do everything we can to maximize your chances of getting a good night's sleep. And for that, caffeine we know is a stimulant. What it does is it uh, counteracts some of the substances that our brain builds up over time that make us sleepy. It
Hmm.
takes about 6 hours for it to clear out of our system. So if you're planning to go to bed at 10, we want, say, about 4 p.m. That should be your cutoff time for your last caffeinated drink, whether that's coffee, tea, soda, anything.
Stimulating the sleep environment is concerned, to stimulate the environment.
Mhm.
What's suggested? I mean, you are a psychiatrist, you're a doctor, from that perspective. But
Mhm.
what are the things before sleep a person should practice, as in to develop an environment where they can peacefully sleep?
Right.
Whether it's a music or something else or screen and all those parameters. Just
Mhm.
throw some light there as well.
Right. So there are two components to this. One is you're mentally preparing yourself, and then there is your physical environment.
Mm-hmm.
The mental preparation is basically having a wind down time. So again, here rituals help. So you have a set time that you have your dinner. After that, there are activities that you do. And then you need to have certain time where you're calming your brain down, sort of getting it ready to rest. So that means turning off screens, sort of getting off of social media, making sure that you're not activated, you're not actively thinking about things right before going to bed. So giving your
Mm-hmm.
brain that chance to sort of relax. And in terms of the physical environment, it's making sure the bed is a quiet, comfortable place. There are no disruptions in, particularly this time of the year, at least in the United States, in the northern parts, there's a lot more light. So making sure you have the appropriate curtains, blackout curtains if necessary, and also paying attention to the temperature. So usually we recommend about 68 Fahrenheit. That seems to be the ideal in terms of temperature. So not having it too cold, but not too hot either.
Oh, wow. That is a very interesting point now. I'll go to the temperature again. You said 68 Fahrenheit is the standard temperature for a good sleep?
For most people. So when they have done controlled studies, it's around that temperature that people tend to sleep well. It's having it too warm usually is actually counterproductive to sleep.
Okay.
And just sort of sticking to the temperature theme, there are also studies showing that if you take a bath roughly about 2 hours before going to bed with warm water, that also helps.
Very nice. That's interesting to know. So now I understand why my son wakes up in the middle of night, says I'm feeling too hot with 72 Fahrenheit temperature.
Maybe he needs 68.
I need to adjust my thermostat.
Yeah.
All right. Thank you so much. This is interesting fact. We never, thought about the temperature playing such an important role.
Mm-hmm.
And as far as bathing is concerned, you are saying 2 hours before the sleep is much better.
Yeah.
Mostly people take bath before sleep also, like just half an
hour. If you're sleeping well, really no need to change anything. If you are not and you're trying to optimize your sleep, these are certain strategies that can be helpful.
And how, like the screen time and everything, as you say, is stay away from the screen for how much gap should be between your actual sleep and then shutting off all these devices?
So again, with the devices, there are sort of two theories. One is that all the devices emit light, and the light can be activating. This, we feel at this point, is really, the amount of light is minimal. It can still have an impact, but what is much more important is the content and how activated you are based on the content. So if that sort of revs you up and you're thinking too much, it's sort of difficult to relax, calm down, that can impact your ability to get to and fall asleep. Thank
you. I have another question related to the kids. With the screen culture and the online gaming culture increasing, of course, sleep is one part, and I will talk in detail about the behavioral issues that are coming up with this kind of specific addiction, So one is with the kids playing video games late night. What are the other impacts other than not sleeping on time would you see?
Right. So again, this is a contentious issue in that the research goes both ways. As long as they're functioning well, so if they're doing well in school, otherwise are physically active, have no other complaints, if they play a few video games here and there, the amount of time they spend is not too excessive, it's not bad in itself. If it starts becoming a problem, again, they are unwilling to let it go, they're not sleeping, so sort of prioritizing gaming over other activities, at that point, you've sort of started to realize that this is getting out of hand. Being mindful, watching for these signs, and sort of interrupting this very early on is going to be helpful, because once it sort of gets set as a pattern, it becomes harder. It can still be done. But as parents, we need to set limits, and the limits need to be clear, transparent, and consistently enforced.
Now, considering the situation that parents are working, most of the parents are working, work from home, and they can't monitor their kids for the whole day. They give the screen to them. Most of the kids are playing on screen. Sometimes they're watching TV or playing some online games, shouting, yelling on top of their voice, like games like Fortnite and Minecraft and whatever, I don't know, you killed me, I killed you, and all those things going on, they are aggravated in behavior. There was a time when they would go out and play physically, use their strength and energy. Now they're more energetic, and kids have more energy. They're like they're full of energy, that cannot be contained, and the parents can only do so much. Of course, they'll give them food on time. They'll ask them to study, and they'll check if the class virtual classes are done and everything. But when they come back to these online games and start shouting, yelling, and investing their energies there. And as you said, we have to intervene at the right time before it gets into a behavior issue, So how do we assess the situation now? This has become a behavioral issue with the kid now. The kid is highly invested into the screen now. What is the way out to intervene and stop it at the right time? Number one. Number two, what could be the probable cures for this kind of addiction getting heavily onto the behavior of the kids? They become impulsive, restless, and they would not listen to any commands, what parents are asking them to do. They would just be engrossed into this thing. This has become a very big issue these days, and with the screen time will definitely occupy more time for these kids to be busy somewhere. Parents, try to let it off like this because they also have to do other office meetings or other things, or mom has to cook and all, as you see, the parents do. This is something serious. Throw some light on that.
So again, as long as they have fixed routines, so you have expectations that you get up at this point, this is school time, this is the time that you get to play your video games, and same thing, consistent, clear, transparent boundaries. So you say you get an hour and the hour is done and it's over. There are really no discussions after that. Plus building in some kind of physical activity, even if it is indoors. So most states right now have certain exceptions where people can go to certain places outside to exercise. So as long as you can do that, that's great. So building that into their routines where they have this timetable, you don't need to stick to it to the T, but at least have some idea that this amount of time you're spending outdoors, this amount of time is schoolwork, this amount of time you still get your gaming time, but this is the amount of time, and once it's over, and enforcing that. If it starts getting out of hand at that point, again, having the conversation with your kid, making sure that they understand that these are the rules, these are the reasons for the rules, and that you're going to implement them. And there can be consequences. So there can be certain privileges, things that go away if they don't sort of stick to their end of the bargain.
So what is the maximum screen limit time you would put? Screen time limit you would put?
It depends, again, on the kid, the age of the kid, and
maybe now teenagers. I'm speaking more about teenagers now. This is the culture. Not exactly tweens to teenage, of course. Up to their 19 and
right.
11 to 18 years of age, rather.
Yeah. Like so the American Academy of Pediatrics has come out saying that 2 hours is what they recommend, but this is for the younger ages. With older age now, it becomes, especially in the current situation, becomes harder just because so much of schoolwork is done online.
Right.
I think sort of trying to keep that separate, that school work time is really not technically screen time, but screen time you can count as extracurricular things that they do.
Mm-hmm.
It depends on the kid, the parent. I would say try to work out a reasonable compromise, again, stick to it and leave it there. You don't need to have like a hard and fast rule that everybody follows this cutoff time.
Thank you.
Work out what's reasonable for you.
Thank you. Before we go into a break, I have one more question. Have you seen kids, the cases of kids where they have gone into this kind of addiction, where they have spent 8 to 9 to 12 hours in front of the screen playing games, and then they had behavioral issues? Generally curious about that. What kind of ratio of that segment would be, like this kind of kids would be?
Right. So this would be more in the realm of child psychiatry, which I don't practice, which I trained in. But from my training, I still recall that we see a fair number of these kids. And again, once it gets out of hand, it's a little difficult. It comes back to a lot of behavioral therapy, family therapy, sort of helping the parents set rules and enforce them. But in our addiction practice, as such, we deal much more with substances, so things like alcohol and opioid.
So, Dr. Kola, about this addiction, you have expertise in alcohol and opioid addiction, basically. You treat patients. Now, of course, being in a lockdown situation, there are people, of course, what to do when we're sitting idle. Let's open some bottle of wine, and scotch and other things, and they might not know when they're crossing their boundaries in this situation. So about normal addiction, we'll talk first. We'll throw some insight about addiction as in general. What kind of addiction people can have with substance abuse, be it over medication or alcohol or controlled substances.
Mm-hmm. So the data clearly show that the most common addiction actually is cigarettes or smoking, nicotine or tobacco use disorder is what we call it technically. That is the most common, followed by alcohol use disorders or alcohol addiction. And so nicotine actually has a much more significant impact in terms of quality of life, health over time. But most addictions, if untreated, if they get out of hand, can be quite lethal even, and significantly impact uh, interpersonal relationships, occupations, and physical health.
Okay. What kind of cases are you seeing these days with COVID lockdown?
So a lot of times for us recently, it's been people who have had some degree of success or sobriety. They've sort of given up their drug of choice, but with the current circumstances, they can't really make it to treatment. If they are part of, say, AA or other self-help groups, can't get there because of the social distancing. So they lose some of those support systems that they have in place, and that puts them more at risk. So we're seeing a little more impact in terms of relapse to their substance of choice, alcohol usually. And with opioid use disorders, a lot of times the primary treatment is medication. So we prescribe medications to help with the opioid use. And if you can't make your appointments, these need to be prescription medications that the physician writes. So if you can't make it to an appointment or to the pharmacy and you start running out of these medications, that again might put you at risk for relapse.
Oh, wow. So what should be the role of family in such a situation?
So a lot of times family is extremely supportive. So what they need to know is recognize what can be potential relapse triggers for the patient. So what kind of situations, emotions, circumstances can increase their chances of maybe relapsing. Being mindful of that, having an open conversation again with the patient, making sure that they get the support that they need. If they're on medication, they continue to remain on medication and remain in contact with either their therapist, physician, and trying to make sure that they keep those appointments, even if they are virtual.
Okay. Thank you for the inputs. As far as overdose of medication is concerned, have you seen such cases where people or patients have overdosed themselves? These medications also are controlled substances, I believe. Mm-hmm. And what is the situation there and how to keep a check on that as a family?
Mm-hmm. So usually once patients get stabilized on medication, it's a very unlikely event that they will overdose on it. So when you start somebody on this, you do it very carefully. You get to a dose that you know that they can tolerate. And at that point, they do well on that dose. Mm-hmm. If it's in the early stages, so they're just getting situated with the medication, or if there are any circumstances like we talked about where they're experiencing other stresses where the family is worried, then making sure that there is some degree of accountability. So either making sure the medication is locked and regularly dispensed, or the patient does not have access to too much, where the amount that they have, if they take all of it, is not going to be lethal. So making sure that that happens. And again, open communication, making sure everybody is on the same page, and making the patient feel comfortable that if there are issues, they can bring it to their family. They can feel confident that they will feel heard and the family will support them.
Thank you. Thank you for the valuable inputs. Another question comes to our social drinking habits, or say alcohol, when we speak about. When do we cross the actual boundaries where we call it alcohol addiction, or it's just 2 or 3 packs of social drinking? How do you differentiate between both?
So there are two separate issues here. One is what is addiction, and one is what is safe limits in terms of drinking. So the safe limit question is actually much easier to answer because the National Institute of Health has clear guidelines. For women, they do not want you drinking more than 7 drinks per week. And for men, that's 14 drinks per week. So that equates to either 1 glass of wine, 1 beer, all of those are considered 1 drink, or a 2-ounce pour of any of the hard liquor. So whiskey, vodka, things like that. And at the same time, they don't want more than 3 in one sitting for women and more than 4 in one sitting for men. And this is based out of a lot of research which shows that once you cross those limits, your chances of developing an addiction go up substantially.
Wow.
What is addiction is a different question altogether, which is, at least the simplest way to think about it is loss of control. So if you can't control the amount of the substance that you're using and it's having an impact on your life, at that point, it's likely an addiction. which is what we want to try and prevent, which is why we recommend the safe limits.
I understand that now. So you speak about 5 glasses of wine a week.
Not more than 4 in one sitting for men, not more than 3 in one sitting for women.
All right. So people who fall after 2 glasses also are falling into that line that they are.
Well, if you can only drink 2 and you're very drunk after the 2, it's actually protective. You can't get to the 3 or 4.
All right, all my dear viewers, I know I'm asking some serious questions about your health. Spouses sitting next to each other might be judging, okay, there I stop you and then you got to stop me. So keep a watch. It is community special here, that's program that is focused absolutely on your good well-being, basically a good living. So I know there is an element of fun here right now with social drinking and the normal drinking habits we speak about. As far as regarding kids, I would speak about now with addiction. There are certain cough syrups and a couple of things, that could be addictive or that could be, not usually taken by the kids, or overdose might give them a little kind of different feel and all. Any guidance for the parents, basically, to keep a check on certain medications which are over the counter but still at home, which could give easy access to the kids, basically?
So with most cough syrups that can likely be problematic, they contain a substance called codeine. Codeine is an opioid, but it can suppress cough, which is why it's there in a lot of cough syrups. That can get, if you consume a lot of it, so if you drink the whole bottle, that can have an intoxicating effect. So making sure you read the contents of the things you get over the counter, making sure if it has codeine, and even if it has alcohol, making sure it's locked, there is some degree of accountability there too.
So basically, my question, why I'm asking is, see, we have openly accessible medicines at home, like NyQuil, So nighttime NyQuil, they say NyQuil and Dayquil, right? This is the product. Similarly, there are other nighttime syrups like Robitussin would have it and all. And yes, I mean, that's where I think we need to keep it away from kids.
So yes, it's generally safe to keep pretty much all medications under lock and key. NyQuil contains diphenhydramine or Benadryl, which is what is making you sleepy at nighttime. And that can also in high doses have a little bit of an intoxicating effect. As a general rule, all medicines, better to keep them safely secured. It's not just that they will purposely misuse it. You don't want kids accidentally getting to it too.
No, what happens is, supposedly a kid has cough syrup, has cough. We gave him 2 or thrice, like twice and thrice, in following days. Then they feel, okay, this is something I look up to have again. That's what, these are the limits. I mean, of course, not specifically. I'm generally curious to know about all these things which are available at home. We are very much monitoring each other, keeping an eye in the situation. Now, as far as mental health is concerned, what do you recommend for a healthy living, mental health, basically, when I speak of? What kind of, if there are certain exercises you recommend or other things you recommend as a, day-to-day activity, which keeps the mind active and happy and, happy, healthy, basically?
Sure. So again, with the current situation, a lot of people are sort of isolated, don't have too much contact. So making sure, so you don't have physical contact, but that does not necessarily need to translate to no contact at all. So making sure you use electronics, use sort of virtual spaces to connect with friends and family. This doesn't necessarily mean you mindlessly forward things you get, but making sure you get that connection with people who care for you, whom you want to speak to, maintain that contact with. Again, routines, making sure you have regular sleep-wake times, things you do at particular times of the day, paying attention to your nutrition, so eating right, not overdoing it with snacks or other things, building in exercise. A lot of times what can be helpful is having some purpose or goal. So learn a new skill, learn a new language, so have some kind of goal that you can achieve with the amount of time that you now have on your hands. The other things people can do is being mindful. So there are a lot of apps that are available. So Headspace is one that comes to mind. Mindfulness is being in the moment. So you can't change the past. You really can't control too much of the future. So why waste the present right now worrying too much about either of those? So staying in the moment, being more mindful. Other things are things like being helpful. So if you can contribute in any way to local charities, whether it is virtually, if there are meals you can drive, drop off, phone lines you can man, doing any of those things that will give you some sense of purpose and meaning right now, that would be great too.
Awesome. This is very interesting. With the current social media becoming active, of course, people are spending time. I see people making TikTok videos, people having Zoom sessions with friends, and I believe this is healthy in that case.
So it can be healthy as long as you're sort of being creative, you're connecting with people. Yes.
All right, perfect. So Dr. Kola, as far as your specialization is concerned with the insomnia, I have one more question regarding sleep apnea.
Mm-hmm.
Now, one, I will definitely want you to explain what sleep apnea means, and then what factors can lead to sleep apnea. And in this situation, when we are stressed, anxious, people might have hypertension, diabetes may increase due to stress and all. How sleep apnea happens or can get, like affected as well?
Sure. So there are two different types of sleep apnea. The most common one, about 90% of the cases we see, which is what most people know as sleep apnea, is called obstructive sleep apnea. So the upper airway, the part behind the nose and the mouth, so all of this is muscle. When we go to sleep, muscle tends to relax. And if it relaxes too much, it can close off. So when that happens, you're trying to breathe in your sleep and you're trying to move air into your lungs. But because the airway is collapsed, you can't get air in your lungs. If there's no air in your lungs, there's no oxygen in your bloodstream. And your brain requires a constant supply of oxygen. If it doesn't get it, even if it's for a few seconds, it'll wake you up. So that disrupts your nighttime sleep. So that can have two sets of consequences. Because your sleep is disrupted, you're more sleepy, more tired the next day. And that can increase your risk of motor vehicle accidents, crashes, things like that. It also impacts your ability to concentrate and pay attention. But more importantly, what sleep apnea can also do is each time you wake up, there is this surge or release of adrenaline through your body. And that impacts your heart, your blood vessels. So it increases the chances that you have high blood pressure. If you have high blood pressure, it makes it more difficult to control. It also increases heart rhythm abnormalities, increases clotting disorders, things like that. So it has a lot of cardiovascular consequences too. So for both those sets of reasons, we worry about and want to treat sleep apnea if you have it. You had asked about what are the risk factors or what can likely cause this.
Right.
Main risk factor actually is weight. So obesity. So the heavier you are, the greater the chances that you have sleep apnea. Age, as we get older, muscles tend to relax, so that increases your risk too. And men, like with most other cardiovascular risk factors, men are at increased risk as compared to women. So those are the three main things.
And how does snoring play a role here?
So snoring is a risk factor again for sleep apnea. What snoring is the upper airway, which is all muscle. If it relaxes but doesn't close, as the air is moving, the tissues tend to vibrate. So that's what we hear as snoring. And snoring, we know, is a risk factor. It just tells us it's a narrow airway to begin with, so you're more likely to have sleep apnea.
And how do people diagnose sleep apnea otherwise, generally?
It has to be a test. So we do the exam, we speak to the patient, but usually it is a sleep study. And you can do the sleep study at home or in a lab. And basically what we are looking at is breathing patterns and brain wave activity and oxygen levels. And if we know that if you're stopping breathing a fair number of times per hour, that sort of qualifies for a diagnosis of sleep apnea.
Thank you. Very, very valuable inputs you have given about different aspects, whether it's sleep apnea or addictions, and of course about kids as well. We explored a lot. So with your experience and expertise, in addiction and the cases of insomnia, does addiction also have any relation to insomnia?
It can. So it cuts both ways. We know that people who have sleep problems tend to have higher risk of developing addictions. But at the same time, if you have, say, a tobacco use disorder, or you smoke, or you're drinking excessively, that can also impact your sleep and cause the insomnia. So it goes both ways.
One particular question about drinks. People think when they drink, they sleep well. Is it true or false?
Well, it is both.
Really?
So what tends to happen is when you drink, you get off to sleep quickly.
Okay.
So alcohol is slightly sedating. We do get accustomed to that very quickly. So you fall off to sleep quickly, but in 4 to 6 hours, our body converts the alcohol into what's called aldehyde, which is a stimulating substance like, say, coffee. So you fall off to sleep quicker, but the second half of the night sleep is much more disrupted and you wake up earlier than usual, and overall sleep quality deteriorates too. The other things alcohol can do is, because alcohol is a muscle relaxant, if you have sleep apnea, it makes the sleep apnea worse too and the snoring worse too.
Oh, wow. Okay, so if you drink, you might be snoring more.
More.
All right. All right. Interesting. Pretty interesting. And I think pretty much I've covered most of the questions that relate to these parameters. And other than that, as far as, when we speak about managing our mental health, you've spoken about maintaining a routine and everything, right? As far as doing something beyond, we are not reaching out to a doctor for prescription medicines, say, supposedly. What are the other parallel routes a person can resort to when they suffer from these kind of things? Is there anything like any psychotherapeutic measure that can be done at home or through a consultation through some life coaches or somebody? Generally want to have some light from you.
So in general, for sleep, there are various what are called computer-based cognitive behavior therapies that are available. So these are, a lot of times you pay a small amount, but there are free ones that are available too through the various app stores. The basic idea is, don't go to sleep unless you're drowsy. So go to bed only when you're starting to feel sleepy. And if you wake up in the middle of the night, you can't fall back to sleep, get out of bed, do something that's calming, relaxing. And when you feel you're drowsy, go back to bed then. And that's basically what most of it boils down to. There are more nuances to it, but that would be a good initial strategy, at least, to employ.
Thank you, doctor. I think it was a great session today with a lot of insight from people, and I believe now people would know how to sleep well and what are the things they have to keep away from their bedrooms, or not to practice before, if they want to have a nice sleep and keep their peace of mind. About last thing would be about domestic violence cases increasing in the current situation. I know I know your area is not that though, but it is somehow interlinked to the behavioral things that are related to addiction or even sleep, like insomnia, because people who do not sleep might not exactly behave well, right? So how does a family cope up the whole situation? Because domestic violence may happen in this situation. I mean, precaution, what would you say there?
I don't know much about precautions, but that should not happen. And if it does, it needs to be stopped immediately. So there should be, I would say, zero tolerance to any kind of physical violence, even emotional violence, and making sure that everybody in the family is on the same page. So there is no real condoning of this behavior, making sure that if somebody has a mental health disorder that might make them prone to violence, if they have a sleep problem that might make them prone to violence, or an addiction that might make them prone to violence, treating the underlying condition, but at the same time, pretty much a zero tolerance policy.
Certain families, because of stigma, do not approach the doctors. Mm-hmm. This is one thing. As a psychiatrist, I want you to convey a social message to masses. What happens is mental health is taken as a stigma somewhere for the common masses, where they believe that somebody is suffering from mental illness is antisocial. They simply outline it like this, which is not true case. As a doctor, physician, expert in this field, convey some guidelines for public to understand and cooperate with such people who suffer from certain mental illnesses, and what would be behaviorally acceptable in the society as well.
So the basic message that I would want people to know is that there is no health without mental health. It is an essential part of your health and well-being. Mental disorders are brain disorders. So they are biologically based. And as a sort of corollary to that, all of these conditions are treatable. They're treatable only if the family sort of recognizes them, gets the patient to a person who is qualified, and this can be medication, it could be psychotherapy, but these are treatable conditions which, if we treat, the quality of life for the patient is substantially improved and for the family as well. And making sure that you sort of recognize that and not let other considerations sort of come in the way.
Thank you so much. Thank you so much, Dr. Kola, for all the great insights today about our, mental health. And I'm very sure my audience might have really got great information from you, and they know how much to drink now and how much not to. Thank you for your time today. It was a great session.
Thank you for having me, JYOTSNA.
Appreciate your time. Thank you so much. And my dear viewers, this was a session today with Dr. Bhanu Prakash Kola, MD in psychiatry. Excellent inputs he has given about, insomnia, about addiction, about many other things, and your mental health, how best you can keep and how well you can sleep. Keep them in your mind. Stay safe, stay at home, and keep waiting for our next session. I'll come back with some very, very interesting topics again. Till then, God bless. Thank you. Bye-bye.